Shanna. Hey, Mama. Hey, Malika. Hey, Key. I'm glad you made it. Thank you. Sorry, we're just doing some quick things. Excellent. How's everybody doing tonight? Mom, please don't send a request to be on. Thanks. Hey, Sharon. How are you? Hey, my lotus flower. I'm so glad you guys jumped on. Thank you so much. I'm having a little panic moment. I got my hair colored 2.5 weeks ago, full root to end. Okay, just want to show y'all something. What's that? That is gray. That is not supposed to be there. I'm totally freaking out about it. The 4th floor is in the building. So anyway, I'm flipping out about this. This is problematic, this white, because it was supposed to be gone when I got my hair colored 2.5 weeks ago. Does hair really grow that fast? I don't know. I guess it's all a part of the menopause, maybe, journey. We'll ask Dr. Jessica when she gets on. But I wanted to tell you guys a little bit about how I met Dr. Jessica. And it's a total God moment. So I honestly had a girl crush on Dr. Jessica Shepard years ago when I first got on Instagram. I was following her. And one of my friends, Agatha, had a party at her house. And when I walked in the door, Dr. Jessica was there. And I totally was like, whoa. Like I fanned out a little bit, right? I was so excited. She's just an amazing physician and always has been. And this is just me following, the virtual piece. So we took pictures together. We had a good night, and that was that. And we just started following each other, watching her career, because she's an OBGYN. She was in Chicago, a surgeon, all of that, and moved to Dallas and opened Sanctum Med and Wellness. And we just kept on following each other and encouraging each other. And then she started being on Good Morning America, the Today Show. And Sanctum just grew. And she just really has been doing so much on the menopause front, women's health. She's just an amazing human being. She leans functional medicine, which of course, is something that's near and dear to my heart. I'm not necessarily a huge fan of conventional medicine. She leans functional, which is great. She loves getting to the root cause. And I felt by having her on today, it would be helpful. And I was so glad that she could make time in her schedule to, jump on live with me and really talk to all of us about menopause, perimenopause, and women's health in general. I have some questions, but I really want you guys to be interactive, right? Hey, Kelsey, thanks for coming. I appreciate you. Hold on. So I'm going to wing it. What else? So I am really excited about her. I think you guys should follow her. She also has another page called Modern Meno, and she does the whole full-on menopause thing on that page. But she also does it on her Dr. Jessica page. So we will see when she gets here what that's going to be. She's just running a tad bit late. What else is going on with you guys? Talk to me. Nobody's saying anything. Who else joined? Let's see. This live thing is honestly quite complicated because you see all the people coming in. You want to say hi. You want to acknowledge everybody. And but it's hard. It's like rapid fire. It's kind of freaky. Yeah, I'm sorry, I'm just reading. Hey, Heather. Thanks for coming. Hi, Fatima. Thank you for coming. As I said, guys, Dr. Jessica's just running a tad bit late. Hey, we have another doctor in the house, Dr. Nadine Underwood. Hello. I did say Nadine, didn't I? Oh. Yep. Oh, thank you, Kia. I appreciate it. Anyway, Dr. Nadine is married to a friend of mine. She's an emergency room doctor here in Atlanta. Not so much anymore. She also runs a very robust, she's a travel influencer. That's crazy, right? She's a doctor and a travel influencer. Crazy, crazy. It's called The Soft Life. And it's spelled THESOPH is life. Go follow her. She's dope. That's all I'm going to say about that. And I might need to have her on, don't you think? Anywho's, let's see what else is going on. So, also, I don't know why I have been, I'm so nasally. Do you notice that? Do I sound really nasally? Because I think I do. But anyway, super nasally. And after I came back from New Jersey last week, I just was like not feeling right, but not viral. So I went and got a UBI treatment just in case I was viral to kind of purge me of any virus or sickness or whatever. And that helped. But I was like, whoa, this still isn't going right. So I went and got a, what do you call it? I got a hydrogen peroxide and glutathione nebulizer, and I got a glutathione and Myers IV. Overnight, I was back to normal, but I still have this really weird, like, nasally thing. And if you know me, you know that I attribute everything to menopause. Like, now I'm like, it's menopause. Don't you find that? Like, I feel like everything is menopause's fault, right? Like, if something goes left, I feel like it is. What do you guys think about that? Like, I mean, if I'm not feeling right, it's menopause. My stomach hurts, it's menopause. Like, full stop. What do you guys think? What's going on? Oh, hey, everybody. Thanks, Sharon. Dr. Jessica's just running a few minutes late. She jumped off a flight from LA and is on her way to us. So she should be here in literally 5 minutes. So we're winging it and we're having a good time, right? Stay with me. Stay with me, family. I need you. This is so weird. Getting older has really been fun. Yeah. No, it hasn't been fun, Dr. Nadine, at all. I'm grateful, right? I'm super grateful that I'm able to age, right? I just don't think I was aware. Like, I said to my mom, Mommy, why didn't you tell me about this? Like, I feel like she kind of left me hanging on that. It was just a weird thing. Like, this, every day it feels like it's something new, right? Not necessarily bad, but something new, and it feels like you have to deal with that newness. So anywho's, all right, so let's get to it. So what we're going to do tonight with Dr. Jessica is everything is going to be from a patient perspective, right? Most of the time we get on and, you listen to these doctors talk to other doctors. That's you, Dr. Nadine. Doctors talking to doctors, practitioners talking to practitioners isn't necessarily helpful to us as laymen's, right? We're just trying to get treatment and trying to get well. So I have a laundry list of questions for her. Just the basics, like what to expect from a practitioner. How do you know that a practitioner is good or they're doing what they should be doing? Because this is uncharted territory, like this menopause thing. I mean, frankly, medicine just started really paying attention to this. So how do you know you really have a great practitioner, right? Or they're doing the right thing by you or directing you in the right direction? Because everybody's different, right? We're not a monolith. So what may be right for you may not be right for me, and vice versa. So I know I take HRT. Everybody's not down for that. I just chose not to go through. I was not going through those symptoms. It was too much. It was just way too much for me. And I don't know about you guys. You tell me. Is anybody experiencing symptoms and and it's fun, right? Like, no, not for me. I mean, it was rough. It was definitely rough. What did you say, Sharon? Our thing is that it's comforting. Yes, yes, that is true. Sharon said that it's comforting and it makes you anxious at the same time. So it is weird. But I just feel like, most of the people that I know, right? I'm one of one. I don't know a lot of people who are on HRT. And that's what we're going to talk to Dr. Jessica tonight about. Like, are there other options? Yeah. Oh, another doctor in the house. Yes. Every person is different and has to consider. Yep, exactly. Yeah, to minimize, because the symptoms are rough. And I'm grateful that HRT worked for me. It actually, it's been great. No hot flashes. My brain fog is, that's subjective, right? The body aches have definitely diminished. I'm trying to think what else. What other symptoms did I have? I didn't have a break in sleep. Did anybody have a break in sleep? I didn't. I sleep good. Trying to think. And my appetite was ravenous. I mean, it was crazy. The dry hoo-ha can be a problem. Yeah, that didn't necessarily go away, but it's not bad. I also had, oh, do our doctors know each other? Oh, Shanna, do you? No, that's definitely not a great thing. I think maybe Dr. Jessica's trying to come in. Hold on, guys. Let me see. No. No. Okay. But that's not good that you don't sleep, because sleep is so important. I'm sure my doctors in the house, Dr. Joy and Dr. Nadine, can speak to that. Like, no sleep, not good at all. And it actually can have some serious health implications. But I'm not the doctor. I'm going to let the doctor speak to that. But again, I don't see how women who are symptomatic are not that they're not taking anything. I don't see how that plays. Like, these symptoms are just absolutely absolutely horrific. Oh, there we see. Look at, I'm doing it. Thank you, Haley. What is HRT? I'm using acronyms and I shouldn't. Hormone replacement therapy. And actually, technically, the new term is what, doctors? Menopause hormone therapy, right? Because technically, you're not replacing. It could have been. It could have been. It could have been. All right, let me see. Sorry. So yeah, it could be, Sharon. Wow. Yeah, see, there's so many, Dr. Jessica's coming. You'll see why I love her so much. Yeah, that is problematic, Sharon. And I think that it's nerve-wracking going to certain practitioners, because, I mean, honestly, if they don't have an answer, it's like, well, you'll be fine. What? Dr. Nadine? Really? So Dr. Nadine saying she was perimenopause in her 40s. Whew. Okay, I think... I think Dr. Jessica is here. There she is.
Hi, thanks for
Can we?
holding the fort. I'm going to change my background. I don't like it. Okay, there. I'm going to do that. I like that better. Hi, everybody.
Yay, Dr. Jessica is here.
Thank
Yes.
you for holding the fort down.
Oh, Dr. Jessica, anything. Let me tell you something. I will wait for you. Okay, we will wait for you. I appreciate you
Hi.
making time. I know you've been traveling. You're busy.
I know. I got
Everybody.
to LA this
Oh,
morning and then I went straight to work. I drove to work and then worked and then here I am.
well, that's what you do because you are Dr. Jessica.
I feel like I want to plant. Look at this. Look how I can make a set. I'm like, I want to plant in my backdrop.
Okay,
How
do
about that?
it. Do it. It's there.
There's the plant.
Oh, yes. Yeah, we can see it. Can we see it,
Can you see it?
everybody? Can you see Dr.
I
Jessica's
need
plan?
ambiance
Yes.
here,
You are
right?
the ambiance.
Well, thank you.
Yes, you know how I feel about you. I was telling them
See, a
that.
plant is a must. We know this. Yes, a plant is a must. Let's get more of that. We should really do it where the plant is just all over. I'm not wrapped up in the plant. First of all, I am so proud of you and excited. We have been talking behind the scenes, obviously, not breaking doctor-patient confidentiality, but you have for a year like had these issues or more, and I feel that not only did you put your pain to purpose by being like, not only am I going to get the answers for myself, but I'm going to help everyone else who would like those answers. And look at where we are. You making a whole new platform. You starting lives every Wednesday. What can I say?
I appreciate that. Honestly, and I don't like to play like this, but I look at you and I'm like, wait a minute. She's a doctor, she's a mother, she's a wife, she's doing all this stuff. And then she gets on live and she does all these things. And I'm like, you know what? I need her in my space. I need her to help people because you're helping so many people. You're doing so much.
And you're such a great cheerleader. Thank you for cheerleading, because sometimes when you're just going, and you don't really know who you're impacting, who's listening.
Oh.
I don't know. You could be doing lives and people are not really logged on. Who knows? But I will say that I appreciate when you're like, thank you, or good job. I'm going to share this info. Very helpful. So thank you.
And you're welcome. And I will say that you are really the inspiration because I listen to your conversations and I'm like, all right, I'm now pretty astute, right? And in how this, but most people are not, right?
There's
and you guys
a big
speak
gap.
at such, right? You speak at such a high level, right? And I feel like tonight, that's why I kind of wanted to say, all right, let's bring this down 1,000. Let's talk bare basics, and then we can build on that, right?
Yeah, you're like building a foundation, and you're building a real nice community. And the good thing is that the community starts from you, meaning you know exactly what people like you in a community would need, rather than sometimes you're right. When we do talk, it's very like the study said that the randomized controlled people are like, how that work?
Right. And how is that important to me? Like, I don't even know. Right. And I feel like I wish everybody could have a practitioner like you, right, that is willing to take the time, willing to validate when necessary, right? So that because that's what we all need. We need practitioners that are like, because that this is okay. It's natural. It's happening. And here's what we can do to fix it. So I'm ready. Listen.
You have a
I got my questions.
She's like a 14 printed.
Yes, ma'am.
College lined papers.
And I do. And so because I was like,
I'm going to encourage everyone who's on to drop your question in the little question. If you see the little circle with the question mark, you will send it to Stacy, and then she can direct those questions into the conversation, which will also be helpful too. So I'm just glad
I have to say hi.
here.
Hi,
Everyone
Lizzie.
wave.
Hi,
Give us a
Jocelyn.
wave. Are you waving to everyone?
No, I don't even know. Is that what
I'm
we
just
do?
loving that Haley loves my plant.
Okay.
Haley, thank you for loving my plant.
Well, there's a few people that are going to like your plant because I have a few plant lovers here. So, okay.
Let's start.
Thank you for educating me on the live situation because look at me. I'm like, let's just go. Let's do it.
Let's do it.
Okay. So I am your patient. I'm sitting in front of you. I know nothing. I feel bad, Dr. Jessica. I don't
Yeah.
know why. What is perimenopause? What exactly is it?
I like to look at it as like if you were an athlete and you're looking at phases of a game, right? You know, so you have this portion where there's a buildup, and that's really what perimenopause is. I always say it's if you were to walk in a room and you had a dimmer switch, and just over the course of 7 to 10 years, you're just slowly dimming that light. So it's not like very drastic. I would say that when you look at most women, they're going to go through perimenopause in over the course of years, which can last 7 to 10 years. And that's really where I think from the medical community we have failed women, is because they may come in with this like random, odd, doesn't happen often complaint, and we're like, you're fine because you're not menopausal. So it was this thing of, well, you haven't reached the goal yet of menopause, so we're not going to pay attention to the things that are happening during that perimenopausal phase. But essentially, that dimming of the switch that I was referring to is when your estrogen levels and other hormones as well, but namely estrogen, starts to decrease just over a slow course of time. After that slow course of time, or during that time frame, is why people may be like, did I just have a hot flash, or I'm starting to have hot flashes? They're not that intense. And some people really do start out with intense. The experiences are all different, but that's generally what's happening over that time.
And let me just say something
Yeah.
about the hot flash. Okay.
Look at
You
your
know
face.
the difference between when I'm just warm and when you're having a hot flash.
When you're blazing.
I have, it radiates.
Yeah.
Like it's like from the tip of your toes to your
Burnout.
fingertips, and then it just pushes out, and then it just goes away.
Mm-hmm. It's amazing, and I hope that we can get to an IG live on another day talking about like hot flashes and how they originate, because it's a very fascinating
I'm
like mechanism.
I'm
And
totally interested.
when you hear it, you're like, gosh, that makes so much sense. But going back to perimenopause, that's that time frame. Then you get to menopause. So menopause is like this hallmark of biologically when physicians know that you are not giving enough estrogen to have a period, right? So during the perimenopausal phase, you may have a period, then it goes away for 3 months, then it comes back for six. So it does this like on and off thing. When you get to menopause, you've not had a cycle in 12 months consecutively. And that's when we know now your ovaries do not have a substantial amount of estrogen, enough to elicit a bleed. That's all it really means, is we know that you've
Okay.
got that 12-month mark where you haven't had a period in that 12 months. And we're like, you've reached that deadline of saying you are menopausal. So really, if you think about it, quite honestly, menopause is one day, because menopause is that day when we're like, you've hit that 12 months. After that, you're postmenopausal. It just means now we know that you don't have periods anymore.
Wait. So you just said
Mm-hmm.
that after 12 months, that means that you're in menopause, right?
Correct.
You haven't had a period in 12
Mm-hmm.
months. And then when do you become postmenopausal?
That next day, pretty much. Because it just, the menopause is just the hallmark of we've reached 12 months. And then after that, you're postmenopausal, because now we know that you've reached that time frame. So menopause is like it's like your second birthday. No one really wants it though, but I'm just saying it's like that one for like 12 months. And then after that, you're
So we're
postmenopausal.
all postmenopausal. Let everybody take a note. We're all postmenopausal. If you haven't had if you haven't had a period of 12 months, on the 12 months and one day
You're
are
postmenopausal.
postmenopausal.
Yeah.
All right.
Yeah.
So now we know we got that. So is every woman symptomatic?
That is a great question. So there was a study that was done. You're like, go back to the damn studies. There was a study that was done, and what that was looking at was the experience of women who are in menopause. Mm-hmm. Most women will experience hot flashes. Not all of them are going to be severe, but roughly you can say up to 80% of women will experience hot flashes. Now you have some who are like, they're pretty mild, or they came but they didn't stay that long. I have women who are my patients who are in their 60s and still have hot flashes, right? So roughly most women generally will have an experience of hot flashes. Now what that means is severity and frequency and how long it stays, duration, that's all experiential, that I would never try and say I know exactly how long it's going to last.
Okay.
I like these
So,
questions that are coming in.
yep. So April asked, what about women with hysterectomies and still have ovaries?
So that's a great question that goes back into kind of like your GYN space of just true gynecology. A hysterectomy, that word alone, is just referring to the uterus. So if you take, yes, so a lot of people thought, I have a total hysterectomy. And I'm like, you still have your ovaries. Because there's nothing in the word hysterectomy that implies I took your ovaries. It just refers to the uterus. And so a hysterectomy, most women will still have their ovaries. The name for removal of the ovary is oophorectomy. So unless someone said you also had a hysterectomy and a oophorectomy, you most likely still have your ovaries. So that's why it's important to ask for people who have had a hysterectomy is to say to your physician, even if you've had it years ago, hey, when I had that hysterectomy, did I retain my ovaries or did you take them as well? I think it's an important question for women to ask, because with women who have had a hysterectomy but still have their ovaries, like I've had plenty of patients who had a hysterectomy in their 40s, but they still have their ovaries. So they doesn't necessarily mean that they're menopausal. They're menopausal surgically. Well, they don't have a bleed because they don't have their uterus, but they have their ovaries.
But it doesn't mean they're menopause. It doesn't mean that they have menopause. So, okay, wait.
Yeah.
So there we go. So if you still have your ovaries, you don't have your uterus, that does not mean that you are in menopause.
Correct, because your ovaries, depending on what age you are, like say before you got your uterus, before the day of your surgery, you were still having a period and you kept your ovaries in, that means that you are not menopausal. It just means that you had a hysterectomy and you're not bleeding. But you still have your ovaries are still like, hello, we're still giving off some estrogen.
Okay, so I don't want to get off topic, but I want to ask this one question. So are your hormones now out of whack? Are you in that?
So I have a great study and I can send you all these. So it'd be nice for you to.
Yeah, I would love to. Yeah. I'm interested.
Not like anyone's going to read it, but still.
I would.
People will be like, thank you so much for sending that randomized trial. What we do know is when you think of a hysterectomy and ovaries are still left, we do show now that people have done it in research that typically women may go into menopause quicker than if they didn't have the hysterectomy.
Okay.
That has to do a lot with the blood flow to the ovaries. So surgically, I think that it diminishes the blood flow to the ovaries and therefore they're not as active as they used to be. But they'll not just shut off. They will not just shut off after you have a hysterectomy. But you will, that duration that to get to menopause typically may be shorter than if you'd kept your uterus. But the important thing is that these conversations really allow people to say that doesn't mean that you should not have a hysterectomy. Like if people are really suffering, like say fibroids or heavy bleeding or pelvic pain, that they should not be like, well, I'm going to go into menopause quicker, so I'm not going to get my uterus out. Right? You kind of have to put it in context of what you're getting the procedure for, why it is. I think it's important for women to know that a hysterectomy does not mean that your ovaries are taken, and therefore to say, did you plan to move my ovaries or not? Because if it was something that they were planning to remove and you didn't know or you didn't want them removed, that should now fall back into the conversation of, do you see how my screen does that? Is that not right?
I was like, what's happening?
So I was on, just like this is so off topic, I was on a Zoom the other day, very serious meeting, and that happened, and I was like, did you just see that? And he was like, and I was like, I don't know what happened, but let's just pretend that didn't.
Let's pretend.
But I don't know why it does that, because it's like must be from hand movement. But
did everybody see that? It's the hand movement.
I think it is.
It's the hand movement.
But I can never replicate it is the problem. So it never comes back. So it seems very.
Oh my God.
But yes, going back to conversation topics, this is why it's important for us to, even at this granular level, have these types of conversations. Because then when you're having things done or you're being put on a medication or you're having a surgery, is to really understand what is being done, why it's being done, so you can make better decisions for yourself.
Sharon, I see that question, but hold that, the nutrition, because I'm all about that, right? Okay, so we talked about the symptomatic thing, right? Like, if you're not symptomatic, if you're not symptomatic, does that mean, are you still going through menopause if you're not symptomatic?
Yes, because all it means, so great question. So say we have someone, I'm going to give a case study of 54-year-old who still has her uterus, went past that 12 months of not having a period, and technically, what would we call her? That's
Okay.
your quiz. This is your
Okay.
quiz.
Okay. So do it
What would
again so I can make sure I'm getting.
if she's
Yep.
54, still has her ovaries in her uterus, but she now does not have her period? What is she?
She's
What would you?
postmenopausal.
Correct. But she's not really having any hot flashes, and she's just like, yeah, I don't have my period anymore. That doesn't necessarily mean that you have to have symptoms.
Okay.
Most people, going back to that study that I mentioned before, will experience some form of hot flash or night sweat. Severities will differ, duration will differ, and frequency. But there are some women who just, when my patients tell me, they're like, I just breeze through menopause. I'm like, because most women are. And so when they're walking around like, this was easy, oh my gosh, I just love, and I'm like, shh, 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 you will be, you will be the bane of,
That part.
existence.
So
I love that. Yes, you were right, Key Vibe, with your postmenopausal. She got the quiz answer correct. You should now, we should be having bingo. We should be having like,
you need to, yes.
with menopause.
Well, I'm about to bingo y'all because here's where here's where I am right now. So I hear a lot of people talking about, well, I don't have any symptoms.
Right.
I think that people are making such a big deal out of this, and it's this alarmist type of thing.
Yeah.
So what I want to talk about, because I've heard you talk about it, I've heard a lot of experts talk about this. There is something happening when you lose estrogen,
Yes.
right?
Yes.
Something very big.
Yeah.
And it's not just simply losing the estrogen. So what are the implications, the possible implications of the loss of estrogen, the health implications? Like, so let's say that you want to thug it out. You're in menopause and you're like, and you're having symptoms. Should you do nothing? Right? Let's say that you are having symptoms and you're like, you know what? I just want to take supplements, or I don't want to take supplements because I can take black cohosh and that'll make me do X, Y, and Z.
Yeah. I have
but there's still something happening, right?
They wanna quote unquote thug it out.
That's right.
Exactly. Thug it out. But I think here's what I would say. The day and age that we're in, with all of the information that you're seeing, and I know you see it as well, and possibly people who are watching, on the virality, I'm gonna term it that, and you'll understand why, of hormone replacement therapy, or menopause hormone therapy, MHT, some people call it that, is that I do believe it is great that we're understanding the importance of estrogen, the loss of it, and trying to get back some supplementation of it because of things that can happen in the future, such as heart, brain, and bone. But I want to make a point, which is very important. Because we know this, we're in this moment kind of in history where we're able to bring back the importance of hormones and what it means for a woman to lose it during this time frame, is that for particularly, let's take that woman that you said that does not have symptoms. It does not mean that if you don't want to take hormones, whether you're having symptoms or not, that now you should be put into a box of being shunned because you decided not to take hormones. I do believe when people hear all the information that's given to them and laid out, they too get to decide, do I want to take hormones or not? Because where I do see information, and this is the good thing about social media, but there's also sometimes a bad side to it, is that because we're so much like hormone therapy, is that there may be people, just like you said, like, I don't necessarily want to take it, and maybe I just want to take black cohosh or ashwagandha, or I would never say, oh my gosh, you are a horrible person for not taking estrogen. What I do want you to know is the benefit of it, but I never want you to think, because I chose not to take it, now am I in this group that, you see this happen in medicine sometimes. So for example, and maybe more people can make kind of a correlation when I explain this. For a long time, we did a lot about breastfeeding, right? Breastfeeding is best for the baby, blah, blah, blah. Because we were trying to get people to understand the importance of it, but it became very important in messaging. What started to happen were then people who couldn't breastfeed for whatever reason or chose to bottle feed, it kind of cast a light on them like, oh,
Right.
well, now am I a bad person? Because right? So it's always important to make sure that we're giving objective information
Yes.
that really people understand. The reason right now why you hear it so much is because for 20 years after the WHI study,
Right.
that was wrong
Wrong.
information of saying never have hormones. And so
And
now
tell
we're,
them what the wrong information is really quick. So the
yeah,
really quick.
the
What was the wrong
WHI
information?
study. So this is where kind of where we're getting with this virality moments of HRT. In the late 90s and the early 2000s, there was this study that was done. It was the largest study on preventative of cardiovascular disease when taking hormones in midlife women. That was actually the purpose of the study. Nothing to do with hot flashes, night sweats, etc. It was simply to say, if we put women on hormone replacement therapy, will that decrease cardiovascular disease later in life? During the study, it was 45,000 women roughly. They put them into different categories. You get estrogen and progesterone, you get estrogen only, you don't get any hormone replacement therapy. So there were different arms. There was a slight increase, and I say slight, I'm trying to find a better word. There was an increase in breast cancer cases. Statistically, this is like the science nerdy part, it wasn't enough cases that it was a direct correlation with hormone replacement therapy, but it was enough for them to say, let's stop the study because it's more cases than we would like, right? They stopped the study to figure out why are we seeing such a slight bump in breast cancer cases? What went out into media was alarmist of hormone replacement therapy causes breast cancer. That's why they shut the study down. And everyone like ran. Like it was dark and everyone was like, I'm going to go in my corner and never talk about hormones again. Let's shut it down. And the overwhelming message became, and still today I hear it, both from doctors and general population, stay off hormones, you'll get breast cancer. And I'm like, eh. But they shortly realized, but this is the scientific part. This is why science and research is so important. Years later, when they do the retrospective analysis of a study to examine why these things happen, they realized it wasn't even the estrogen, it was the type of progestin that they used in the study that actually those were the women in that arm of that study because of the exposure to that progestin that got the breast cancer. But the damage had already been done. It was very hard to retract any type of, we did a study and look back at it and this, everyone was like, no, we're sorry, we're done, hormones gone, it's a wrap. And now here we are 20 years later, 20 years later for us to be like, hormones are okay, everybody.
And I needed everybody to hear that from you because it's important because we hear a lot of it.
I still
Hormones cause breast cancer,
yeah.
right? It's a thing, and again, individual. Everybody has a separate situation and needs to deal with their own practitioner.
Yeah. Yeah.
But what we're
And
saying
we
is that
still
this is the study.
changing the message and the damage that was done in the medical community. Because there are a lot of physicians who are still like, I'm not putting you on hormones, it causes breast cancer. Because that's what the prevailing message was. So there's a lot of work to be done. And so this is where you start to see anything that happens and you're trying to revert the message, you see it overall increase, like hyper message is what we're seeing in hormone replacement therapy. But I'm glad you brought up that question in that way, because I do want people to understand if there is a reason you don't particularly want to take hormones, you don't feel like you need to, you've been given all the information, you're still like, I'm fine, you should not be judged either.
No.
Yeah.
No, and I just think that for me now, understanding the health implications of the loss of estrogen,
Yeah.
which could be heart disease, osteoporosis, etc.
Yeah.
I'm like, yikes. For me, I'm willing to roll the dice, right? All right. So Sharon is asking about what your thoughts are on nutrition and menopause. Can you hear me? Oh, all right, good.
Well, let's
Yes.
go back to the question before.
What was that?
Nutrition.
Yes, Sharon, that's what I was talking about. Yeah. The lower occurrences of menopause symptoms in Eastern countries.
With more soy and plants in diet. So this is actually a great exposure to food and nutrition on what happens to our bodies internally and metabolically during the perimenopause and menopausal phase, is we do have a shift in how our bodies function, how they utilize glucose, the insulin glucose relationship, increase in cortisol. And our bodies are really like machines. And so it's like these small little parts start to act a little funny because estrogen's not there to kind of help everything go into play. So there are a lot of metabolic changes which require, to me, a really big change and transition in how we look at nutrition and diet going through this phase. But the reason why this question is important is because we do, when we look at those studies that look at most cultures such as Japanese and Chinese women really have lower instances or severity rather of hot flashes. So their hot flashes are not that much. So there has been a lot of implications on how they eat, which typically anything, compare anything against a Western diet and we gonna lose.
Right.
We have lost that fight.
Lost it. Lost. And the train
Nutrition.
has left the station. Yes.
So I would never put any study up against our diet and try and look at an outcome. We will lose. But in general, one, they eat more whole foods. They do eat more soy. Their portion sizes are smaller. So there's just a lot there already nutritionally that they do differently. But they also have more movement and exercise in their actual daily lives, which again is another correlation to why people will have decrease in some of these symptoms or can mitigate some of the symptoms that they have with movement. So there is a study that came out recently about Tai Chi and how that actually decreases hot flashes, right? So in general, their lives are different, their movement is increased, their diets are better, and so they do have a decrease in symptoms that we've seen in studies, like over a long course of time. They just have a difference in how they have reports of their hot flashes and night sweats. So I think it does have to do with their diet. They have more plant-based, they have more whole foods, they don't process their foods as much. And so it has a lot to do with how they eat, what they eat, portion sizes, and also more movement. But yes, I think that if that's a good starting place for people to say, what could I do in my lifestyle that could actually help with some of the symptoms that I'm having, is look at other cultures that do it a little bit differently and say, what do they do better? They eat differently and they work out more. They have more movement in their days. So yes, the answer to that is I really love seeing the data on that. I do think, however, that there are some genetic reasons in why they have that. We're not that far in research to really understand the genetic portion of why their symptoms are less. Do I think we're going to get there and understand that more? Absolutely.
Wow. That's,
yeah.
Wow. Well, so speaking of that, right? The numbers, the percentages of Black women and how we deal with, or how menopause impacts us, to me, is staggering.
Yep.
Right? How we sleep less, right? Our sleep is impacted more. Our hot flashes are more often.
More severe. Yeah.
Yes. Okay. So, like, I just feel like it's the narrative that, if white people are suffering, then we're on our last leg, Black people, right? So to me, with our, how we feel about, medicine and practitioners, and I even am uncomfortable, right? That's why I chose to go functional medicine, because I feel like it's the way it moves is different.
Right.
How as a practitioner, I mean, you're really good at what you do, right? How do you overcome that? Because I'm sure people come to you and they're like, I'm having just by the fact that I'm here, right? Like, I don't even want to be here with you, right? I don't want to get treated, but we need to get treated.
Yes. So I think that comes in the conversation. I've seen so much, and this happens, it elicits more questions from the patient. It creates more of a trust level in the information I'm giving and why I'm giving that information. But I also think, because I have navigated down functional medicine and truly understood how the root cause of something can be impacted, or you can see improvement through just lifestyle. So you have to be able to order up the lifestyle practices that are going to help, in addition to medication, in addition to possibly supplements. and going across the board and being able to present all of them rather than just being like kind of with the hammer nail approach and saying, okay, hot flashes, take estrogen. Hot flashes, take hormone. What about the everyday things that you can do over time? Because to me, menopause is a marathon,
Yeah,
right?
yeah,
And
yeah.
so the goal for me in menopause is to get you functionality. And in the aging process, as we start to age, is to get to a point where you would want quality of life at 70 and your 80s that you're proud of. But that requires the small, consistent changes over time. But we've never looked at aging that way. We just looked at it as, well, we're all going to get old, and see you when you get there.
And I love that you're saying that. When I realized that this was happening and I was having some other health challenges, I was like, okay, first of all, I'm on HRT, so
Yeah,
I'm a huge advocate. I'm in
yeah.
because I wasn't dealing with that. I wasn't going to deal with it. It was too
Hmm.
much. But I also said, what can I do? Like I told you, I stopped drinking alcohol, which
Yeah,
was very difficult.
me,
Still is.
me too.
It's
Yeah, and I have it. I would say I've decreased significantly. Like I will have a drink here and there, but I have like I'm fine. Like it's hard, but once you see the outcome of like what you don't have to deal with,
it's different.
you're like, it is so much. It's so worth it.
It's different.
Not to, yeah,
I've decreased the dairy.
yeah,
I'm 90% gluten free, right? Like little things like
little
that.
things. Oh,
My trainer, who I think she's on here, Jocelyn. I mean,
hey, Jocelyn.
I think she's on here, right? Um, my workouts have shifted,
Um,
but like it's all about the strength. We lift, we lift, we lift. That's all it is, and I feel
mhm.
like that has helped me so much,
Yeah, because you're
right?
able to utilize the nutrients that you put in your body, specifically glucose, better because your
Yeah.
muscle is the largest organ that really absorbs that and uses it. So if it's not built up, in menopause, our muscle mass starts to decrease significantly. So if we don't do anything to boost our muscle mass, it can't absorb the glucose. It's like, meh, well, I'm not going to do it because I'm not really here.
Well, and that's interesting. You mentioned the glucose and insulin, all that. Like I take
Hmm.
berberine like I'm obsessed with. I
Are
told
you
my
are
my
you
insulin.
ODing on berberine over there?
If my if
He's
my
like, I
blood
may be.
if my blood glucose is over like 95, I'm like, nope, I'm not having
Oh
it.
my,
All right,
you're
like, I
just
don't want
downing
it.
berberine.
Yes, like I can't. I mean, and also, I really try to keep the carbies, the bad
Yeah,
carbies, out of
yeah.
the space, right? Because gluten's not helpful, right? So,
It's no.
um, but I think all these little things, and I think that that's important that we stress that like we also own part of it, right? So yes, I'm on HRT, but I also own part of it.
Yeah, it can never be just one answer and that's going to be the solution for everything. And that's why I feel like it really needs to be comprehensive and something that over time you're just inserting small things here and there. I like this question here. Not sure if I missed this, but can women start HRT in perimenopause? Yes. If so, where can I
Yes.
find the data to share? I can send that to Stacy and she can share that. And the reason why I'm sending this all to you is because I really want to boost your
I
platform. Yeah, because this came out of the conversation, so I feel that you can help, solidify this is why we were talking about this throughout this live, and I definitely share that data.
will
A friend of
also
mine was just told that she can't take hormones because she still is in perimenopause. So I will say that's how I was trained too. So it is not uncommon for me to hear this. We were trained, we can't give you hormone therapy until you are menopausal, right? Because to us, we were like, this is when we know that you don't have enough estrogen and now we can give you some. We have changed the narrative on that because of studies, but it has not pervaded, I would say, most doctors to understand that yes, it is okay to give women HRT and perimenopause that is not birth control. A lot of women will be put on birth control from their physicians as a form of HRT. I'm not a fan of that. I never have been. And so, yes, you can start in perimenopause. And if you find you're not getting the answers you need, that's when it's time to find someone who's going to be able to explain to you why they can start you on it.
so that's I'm glad you said that, Dr. Jessica, about the oh So somebody missed our, okay, what happens if you get a period after the 12 months?
Oh,
Shannon.
yes. I love this.
Ooh.
This is a this is a great question. Okay. So the reason why we went through that definition at the beginning of like 12 months, sayonara, it's menopause, and we're on to postmenopausal state is because from a physiology standpoint, we know you have not been had enough sufficient amount of estrogen to elicit a bleed. So if you're bleeding at that point, we're like, but why? So the scientist in us is knowing you shouldn't be bleeding. Why are you bleeding? We want to make sure that there's no polyps, thickened endometrial lining, which if it's left alone can cause cancer, endometrial cancer. So we are always on the, you know, we want to make sure that you don't have a disease state. And with that being cancer, does it mean that you have cancer if you bleed after menopause? Absolutely not. What is our job? To make sure you don't have cancer. So we always come from a different perspective, right? It doesn't mean that you have cancer. What is our job? To make sure you don't. So we are always wanting to make sure if you have bleeding after menopause, that you've at least brought it up, addressed, and discussed it with a doctor to understand the concept around it to determine, do me as a physician, do I need to now investigate, is this cancer or is it a polyp that I need to remove? What is it and why? Okay.
Well, you made a statement about it's our job to find out why.
Yeah.
I think the challenge is, do most practitioners want to find out
Mm-hmm.
why, which is the functional in
Yeah.
you, right? Why? Or are we just trying to make sure that the bleed just stops and that's it?
No, it should be anyone who walks into a doctor's office and they're like, yeah, I stopped bleeding. You know, I've been menopausal for 6 months, a year, 2 years, however long. And I noticed that I had a bleed last month. And tennis should go up and being like, tell me more about it. Why? How long did it last? It should be, let's discuss this because we need to find out why you're bleeding. It should not be, oh, well, you are. A good question that we'll usually ask now, are you on HRT? Because if you're on HRT and you're being exposed to estrogen and you have a bleed, it actually, we're like, oh, well, that makes sense. You're on estrogen and you've had a bleed. Now, if you're not, we want to know why. Or if you
Okay.
continue to bleed, we want to know why.
Okay.
One should know why.
So I'm going to drop the elephant in the room because
That's your job, is to just drop it. Yeah.
so there are a lot of women
Mm-hmm.
that are over 50 that are still taking birth control, IUD, orally,
Mm-hmm.
whatever. Are we still doing that? Or because that I'm just going to keep it
You're
above.
like, let me just, yes.
It
No,
feels
I'm glad
ridiculous
you
to
brought
me.
that up. I think that is a little bit of a archaic way of giving people hormone replacement therapy is keeping them on birth control pills. There are some women who are in their 40s who still have regular periods. Some women who even into their early 50s have regular periods. From a standpoint of a gynecologist, we're like, if you were having periods, you could get pregnant.
Okay, that's fine.
We know you're ovulating now at this point. So then comes the discussion, how would we like to prevent? There are people who are like, I am still having sex every day. I'm 50 or I'm 49. I still have a period every day or every month. I don't want to get pregnant. So at that point, we're like, let's talk about birth control to prevent pregnancy. Are they likely to get pregnant? No. What is our job? If you ask, make sure you don't get pregnant. So I feel like there's a category for why women might be on birth control in their 40s into 50s. Now, if it's just because I feel like I might have a hot flash, I'm going to be on birth, and they put you on birth control, me personally, not a fan of that. IUD, that's another category to me when I think of the birth control realm.
Okay.
IUD, let's drop the elephant in the room. I have an IUD. I love it.
Okay.
I'm not menopausal, but I'm perimenopausal. I will very openly say, I will be that one who's 80 and I'll be like, we switching out my IUD.
Okay.
And they're like,
Okay, so that's okay. So that's a thing. Yes,
and
it seems to be a thing.
what I do like about the IUD is it gives me a level of progesterone which I think is good. And also now when I'm on estrogen as hormone replacement therapy, my IUD can act as the progesterone in concert with the estrogen.
Did you just say you're taking estrogen and you have the IUD?
Mm-hmm.
Wow. This is what I'm saying.
I know.
So this is a thing.
Flow chart, which is like, what's next? It's like, no, that goes here. It's a lot. Yeah. Someone has a question.
I see. Yeah, I see. Wait.
Thank you. We love our IUDs. My Dr. Joelle said my IUD will stay in as long as possible. We will be 80 together and we'll be like, girl, I ain't taking out that IUD.
No,
listen, I will replace yours and you can replace mine forever. I have a barter system going on now.
Well, you can probably line them up.
Right.
Like, I'm just saying, like you're the person. Everybody's flying to Dallas. Right. And like, okay, go to Sanctum. We're doing IUD removals and
here's a great question. Haley is saying, what is the purpose of an IUD? Oh, at the beginning of it, the purpose of an IUD is pregnancy prevention. It has been approved for people who have heavy menstrual cycles to decrease their heavy bleeding. For people who are perimenopausal and menopausal, this is an off-brand use, meaning that's not what it's approved for, but it can be used for levels of progesterone or giving you progesterone systemically or locally. So it's a source of progesterone. So instead of me now having to take it by a pill, I can rely on my IUD as my source of progesterone. But the purpose, the intent it was made for was pregnancy prevention. Yeah.
I'm blown away right now. So I again, I've been the one telling listen, get rid of that thing. Why do you want that thing? You're not going to get pregnant.
I'm telling them that. And then when they turn up pregnant, guess what?
Baby, look, I'll be turning my back.
Oh, was that me who told you to take it out?
So also, I think a big thing that people want to, like, Sharon was talking about Sharon, what were you saying about health anxiety? And a lot of us have that. I know it started with me with COVID, this anxiousness about, oh my God, I'm going to get sick. And I don't trust people. I'm not trusting these practitioners out here to tell me, don't do this, get the vaccine, don't get the whatever, right? Don't wear a mask, wear a mask, whatever. It started with me there. And then it was like, anytime something was wrong, oh my God, I'm sick, right? But as it relates to whether it's menopause, cancer, anything like that, as we get older, this anxiousness around, I feel like I said, I blame menopause for everything. Like, it's making me go crazy. Like, my mind isn't right. My brain is foggy, everything. Like, how do you, as a practitioner, deal with people who come to you with this health anxiety about not only being in your office, but like, this is wrong with me. This is wrong with me. How do you deal with that?
For me, because I've seen it in a lot of patients, and also because I spend a lot of time with mindfulness and how people process information, why they come up with the reasons, solutions that they're presenting, is I like to put the question always back with the patient and say, well, why do you think that? Or what led you to that belief? I think our belief system is something that is very individual, and it's important for me to understand why they feel the way they do. And also they can see themselves in how they answer. And, as we start to discuss it, a lot of patients are like, you know what? I don't know why I thought that. Or I had a patient today who we were supposed to do a procedure for, and she was supposed to take some medication prior, and she would not take it. And that's what she told her other doctor. And then I was just like, well, remember you had mentioned you're not going to take this certain medication. And I said, but why was that? And she said, well, I had a friend who took a medication and this happened to her. And I literally said, well, your friend is you, and also the medication that your friend was taking is not the same thing as what. So I was able to explain to her the differences, explain to her risks are completely different than yours. And immediately she was like, oh, well, now I know. So now I feel better. And now she can make a decision in order to figure out, should I take the medication or not? It's much easier for her to come to a decision because she feels reassured, but she also understands why. But I also gave it back to her to say, how did we get here? How did you come to a conclusion, and why do you feel that way? And some people are not able to express why they feel a certain way. And I say, well, I want you actually to take the time for yourself, because you are the one who's in charge of your health, to take some time to figure out why you feel that way. so that we can pull the layers back of this onion and get to the real reason why we're here. And it can take time to eliminate health anxiety. I would never expect it to go away overnight. But what I do know is that a lot of it comes from our belief system, what we think. But a lot of times we just have a belief system, we have a belief and we store it, but we don't navigate it. We don't say, why do I think that? We're just like, it's through storytelling. It's through what you heard on the commercial, through a TikTok that you saw, right? So you're just like, I'm gonna store it here. But we don't really take time to whittle it down. We're just like, that's what I believe. And most people, it doesn't even matter, even if it's out of health, even if it's out of like reproductive justice or like, if you're just racism, whatever it is, people have constructs, but many times they don't know why they came up with that. And so when they're challenged with it, then they're like, it wasn't a very sound, strong or belief, so maybe I can let it go.
I agree with that because I created these things in my, like, I don't know where they came from.
I do it.
Yeah. I definitely, okay. So I just have one more question around this practitioner thing. Really, I think part of the challenge is that they're not, in my opinion, it's hard to go to your OBGYN when you're in menopause, right? Like,
I would agree with you. Yeah.
I mean, honestly, you're a unicorn, right? Like you actually said it right. Exactly. Like you set out to, it was very intentional.
Yeah.
Right. How, so you go to your OBGYN and you say, I don't know, I'm 50, I'm not feeling well, and so on and so forth. And you get, well, it's menopause. Like, it's natural.
I think so. If you think now we're trying to, going back to belief systems and what you've been taught, we've been doing that for decades now, right? We were taught a certain way. We've practiced that from when we were taught, and we've delivered that to our patients. Society even said, right?
Yep.
It is a male dominated society. And for them, menopause is not important. So that was poo-pooed. The workplace poo-poos it. So now that we do know more and we are willing to help women, look how many other kind of like bubbles that we have to kind of change. So it will come in time. I think, someone like this is why I say it's almost like this is a historical moment. 50 years from now, we'll be like, remember when people finally just started taking HRT? But prescribers will be prescribing it. Society will understand menopause is a big deal. The workplace will start to enforce certain things that will help tailor that for women as they're going through that time. So we are really at the early beginning stages. I will definitely say that there are, yes, more menopause specialists now. Still, when you think about it, there are more, but even though we're in this bubble of like, there's more, 6,000 women enter menopause a day.
A day.
And so we still are a little bit of a bottleneck effect, because even though there are more menopause specialists now, NAMS does a really good job, or the Menopause Society does a really good job at training people, practitioners.
Is that where people go, Dr. Jessica? Is that where people go to try to find a menopause expert?
They can go to the Menopause Society website, and for those who took certifications on menopause management, whether that's a nurse practitioner, PA, physician, they will be listed there. And so that's helpful for people to at least get an idea of where they can get the care that they need. And then also your menopause telehealth platforms that can at least start the conversation and get you some management plans. So you have MIDI Health is a really good one. My Alloy is another one. And then there is EverNow as well. So these are all platforms that have devoted time, energy, education to menopause. And I think that that's a really good place to start. Is it going to get you all the way? Maybe not, but at least you're starting somewhere.
Right. Does anybody have any questions for what we have her?
Yeah.
Does anybody have any other questions? Let's see what's going on here.
What happens if you get a period? Oh, we did that one.
Yeah.
You get a period.
Which frankly, is a big one. Well, while we're waiting, maybe people have to respond. I want to tell you that Dr. Jessica, so her platform, Modern Meno, which on Instagram, you can go ahead and follow that, because I'm telling you a wealth of knowledge, right? I mean, all day, every day. She's constantly doing lives. She's constantly doing her own posts. It's amazing. Also, Sanctum. I mean,
Yes.
please tell us about Sanctum.
So Sanctum is my practice. So I was in academics for 15 years. And then I got to this point where I was just like, I'm not impacting women the way I want them to. Because, right, what do we do in academics? We see patients every 15 minutes and we keep it going. And I said, I really need to get to the bottom of why women feel this way, functionally, nutritionally, through movement. And the only way for me to do that is to really interact with them on a different level. And so at Sanctum, what we do is we integrate all the parts of lifestyle med, as well as me being, a board certified GYN. We have our traditional Chinese medicine doctor who does acupuncture. We have life coaches, yoga. We have ketamine therapy. We have a registered dietitian. We have a skin specialist or skin changes during menopause. And so all of these things, as women are going through them, the ability to have support and accountability partners to get to that new level of what you need to change is what we're trying to accomplish. And that's what we do at Sanctum.
Sanctum. So we'll follow that too, everybody.
Yes,
So it seems like
Sanctum.
everybody's saying thank you, thank you, thank you. Dr. Jessica, I can't even tell you what it means to me that you jumped on.
Yeah.
I sincerely appreciate you, but I'm going to ask you to do it again, right? Okay. Because we have so many questions. It's always questions, but I appreciate your time. I appreciate everybody jumping on tonight.
Look at this. My son has joined on our.
Your son is joined. Isn't that fun?
He is.
I love that.
He is on our live about.
Right. I asked my husband if he was going to join. He was like, "I'm sorry. Why would I do that?"
Yeah. Hi, Miles.
What? Hi, Miles.
Dr. Yes. Hi, Dr. Joyelle. She says hi.
Oh, Joy. Yeah, Dr. Joyelle. Yes.
Yes.
I'm having her on. Her movement. I'm all in for that
yes.
too.
So I want to be on. I want to make sure you drop the date, which I know you will. And I am so excited to be your first guest on your platform, shiftHER.
It couldn't be anything else but you.
Oh,
I just really quick. Did I tell you guys how I did say it in the beginning before you got here?
Yeah.
So I was a stalker, right? I was really loving Dr. Jessica, and I stalked her, and it just happened to be that we had a mutual acquaintance who had a party at their house. She was there, and literally, I will never forget it. I was so nervous because I was like, "Oh my God, like I love this woman." Okay, and then that was what, 7 years ago?
No more.
Yeah. It had to be.
Yeah.
And here we are today.
Yeah.
I'm sitting on the live with this incredible individual, and you're giving out all this great information. So I appreciate you.
Absolutely.
I support you 1,000%.
You do. And I appreciate
it. I mean it. I mean it. And you know what? And for a myriad of reasons, right? But I am there. I will see you in Austin.
Yes.
For South by Southwest. I will be there for your panels.
Yeah.
So guys, here we are. Go follow Dr. Jessica, Modern Meno. Follow me, Stacey Price, shiftHER.
Yeah. All right.
Yay.
Yay.
Thank you, Dr. Jessica.
Okay. See you soon.
Bye, everybody.
Bye.
See you soon. Bye.